Welcome to Session 2 of Salience Health Therapy. If you missed our first video, go back and watch it first. It's important that you watch the videos in order as they build upon each other. In today's session, we're going to be discussing core values and automatic negative thoughts, and how both of those impact our motivations to behavioral change. Let's start by discussing core values. What exactly are core values? Core values are the deeply held beliefs and principles that an individual considers most important and that shape their choices and actions. The importance of core values in CBT is that it emphasizes the importance of identifying and aligning actions with core values to promote motivation, resilience, and overall well-being. What are some examples of core values? Achievement, valuing personal and professional growth, success, and accomplishment. Relationships, valuing connection, intimacy, and social support. Another value might be creativity, valuing originality, innovation, and self-expression. Another example, health, valuing physical and mental well-being. And lastly, integrity, valuing honesty, authenticity, and ethical behavior. How do core values influence what we're about to learn? Well, number one is motivation. Understanding that core values can help you identify goals that align with your values makes you more motivated to pursue them. Resilience. When faced with challenges, having a strong sense of core values can help individuals stay focused and resilient. Finally, meaning and purpose. Aligning actions with core values can provide a sense of meaning and purpose in life. While both core values and core beliefs are important in CBT, core beliefs are more about an individual's fundamental assumptions about themselves, others, and the world. This is something that we'll discuss later. Core values are about what is truly important to you. If you turn to your booklet, you'll see that there are some activities to help you determine what your core values are. On step 1, you will list as many values as you can think of. And these values can range from any of the things that I mentioned before, can be your marriage, your children, your job, or you can include those all together and say your relationships, your career, your health and wellness. These are all different things that people value. For you, I want you to start with listing 10 different values. And it's okay if you don't have all 10. List as many as you can come up with. Then I want you to take some time and really look at your list of values. Did you leave anything out? Many times, people leave off their negative behaviors, but one can value a negative behavior if it is perceived as protecting the person. Can you see where some negative behaviors could be interfering with your values? We're going to stop there. We'll come to step number 2 later on. Now let's talk a little bit about automatic negative thoughts. Now let's talk about automatic negative thoughts. What is an automatic negative thought? Automatic negative thoughts are rapid, involuntary, and often negative thoughts that arise in response to specific situations, influencing emotions and behaviors. These thoughts are often distorted or irrational and can contribute to negative emotions and behaviors. Automatic negative thoughts are spontaneous thoughts that occur in response to a trigger, often outside of conscious awareness. They can be verbal, single words, or images, and they can trigger intense negative emotions. An example of an automatic negative thought, I'm never going to be good enough, or everyone is judging me. One of those is about self, and one of those is about others. Why do automatic negative thoughts matter? These thoughts reflect the filter through which an individual sees the world around them and sees themselves. These negative thoughts are very common in depressed persons. When a person has repetitive or frequent negative thoughts, they often feel helpless and hopeless, discouraged, sad, and doubt their own capabilities. Often, individuals get stuck in negative thinking such that it begins to impact the decisions they make and the actions they take or do not take. Imagine what life is like when you expect the worst or predict failure all the time. You may not take chances or try to form new relationships. The quality of your life begins to diminish. What does this type of thinking cause such a dramatic impact? Because the spontaneous way we think about our self-worth, the value and intentions of others, and the meaning of the situations we encounter has a strong connection to the emotions we feel and the behaviors we choose. It can even affect the way our bodies feel in response to strong emotions, such as your heart racing, breathing faster, your blood pressure rising, all of these things in response to fearful thoughts or angry thoughts. Have you ever experienced that? Such thoughts can be self-defeating. Because such automatic thoughts often reflect our core beliefs, which are the deeply held convictions about ourself, others, and the world, which form usually in our childhood and may be reinforced from life experiences. These thoughts are strong, powerful, and feel very true to us. Unfortunately, though, these thoughts may feel true. Often they are not based in facts. Who has automatic negative thoughts? Everyone. Everyone experiences automatic negative thoughts, but in some cases, individuals may have very ingrained patterns of automatic negative thoughts that result in emotions such as depression, anxiety, fear, worry, guilt, or behaviors, self-defeating actions, avoidance, giving up. This type of thinking is not adaptive, not healthy, and not productive. Okay, so now that I know what automatic negative thoughts are, what can I do with this information? Well, on a positive note, we can learn skills that can help us challenge and change our automatic negative thoughts. This process starts with learning to recognize when we have them. Once we can recognize the thoughts and the assumptions, and that these thoughts reflect, we can begin to challenge these thoughts. You can begin to examine the evidence that supports or does not support the assumption. Then you can begin to learn techniques to dispute those thoughts and come up with a new, more rational thought. Specifically, how do you learn to identify your automatic negative thoughts? Well, there are a variety of techniques that you can use. You can complete a checklist of common automatic negative thoughts and see if any of those stand out to you. You can learn to pay attention when you experience strong changes or shifts in mood and identify the thoughts that preceded those emotions. You can work with your therapist to visualize situations and explore your thoughts that accompany the visual images. You can record your thoughts and use them as examples to work on during classes or sessions. Role-playing exercises can be very helpful in exploring your automatic negative thoughts. Your therapist can teach you methods to recognize and begin to challenge these thoughts so that you can begin to make progress toward feeling better and managing your life more effectively. Lastly, challenging your automatic negative thoughts also employs a variety of techniques. A common exercise is to look at the evidence that supports or disputes your thoughts. Learning to recognize common types of distorted thinking and identifying the type you are currently using is another helpful intervention. Challenging catastrophic thoughts by examining the absolute worst and then the more likely outcome, that's another skill. Your therapist may directly challenge the validity of your assumptions during a session and challenge you to look at the facts. You may need to challenge sweeping or broad conclusions you come to. You will likely be asked to try rehearsing situations that are triggers for negative thoughts so you can better be prepared to evaluate the situation and come up with a more positive conclusion. Imagining different outcomes for the future will be important. Using coping cards is a way to help the rehearsals go better and have you ready the next time you face an event or situation that has been a triggering event for you. These techniques can be learned and applied immediately, and your skills will grow stronger with practice. So as we continue down this path, you'll begin to learn these skills. The more you implement them, the easier it will be to recall them in moments of crisis.
Well, welcome. I'm Dr. Nancy Donachie,
And I'm Dr. Jordan Brummett.
and we are ready to talk about session 2, in which we're going to discuss core values. So, Dr. Brummett, when people are trying to get their motivation to make changes in life, sometimes they're trying to figure out, why should I do this? What am I willing to do differently? And oftentimes it comes down to what's important to you and what you're willing to change. So when you think about those things in terms of a person's core values, what could we say about that?
So when you think about core values, you want to make sure that you understand exactly what your core values are. And when you figure out your core values, then you can determine how your behavior is impacting those core values in a positive or a negative way. When our behavior is impacting our core values in a negative way, we're more likely to head towards behavioral change. For instance, if family is one of your number one core values and your behaviors are negatively impacting your family time, you're more likely to have a behavioral change in that aspect than if it's not impacting them at all.
So when you are discussing core values, you're really talking about those things that are sort of central and important organizing beliefs that a person carries into their life. And some of those may have been things you developed in your upbringing, in your childhood, or even into adulthood. They're the things that you consider kind of the rules by which you would live, correct?
Yes.
Okay. So how would a person begin to explore their own core values? Because sometimes things are really important to us, but we don't always stop and think about that every time we're trying to make an important decision or move forward with a change.
So I think what we would do is start out by listing the 10 things that are most important to you, the 10 things that cross your mind most during the day. For many people, that can be family, finances, career, the top 10 things that cross your mind throughout every single day. And then you want to kind of whittle that down and go into more of 5. What are your 5 top core values, the 5 things that matter the most to you in this world? And there's no right or wrong answer. Everybody's different. Everybody holds value in different things and different times. And so it's really about what's the most important thing to you right here, right now.
So as somebody is identifying those things and putting that list together, are they stuck with that first pass at that list? Or if they think about this, might they modify that list?
Absolutely. Our core values can change over time. Something that's important to us in our 20s is absolutely going to change in our 40s and our 50s and our 60s. It all depends on where you're at in life and what is most important to you at that time. So your first pass, you may have 10 items, and then after you look at it, there may be 3 that are really important to you, and the rest are just kind of important. Your values change, and you can change in and out of those 3 at any point.
So I guess as you begin to work this through, to work to identify core values, if you find yourself struggling, this is something that you could work on in CBT therapy with your therapist. And this is important because I think we want to operate in life. We want to follow our own rules. We want to have our behavior be in line with those things that we value and we feel good about. Because when our behaviors are not matching to our core values, we tend to feel distress and other negative emotions. So if our goal is to feel better, to feel less depressed, less anxious, less unhappy, to have better self-esteem, we do need to pay attention to these things and figure out ways in which we can better align our choices to our values.
So what comes next? You guessed it, homework. Previously, we discussed core values, and you listed out as many of them as you could come up with in step 1. Now we're going to move on to step 2 as your homework. I want you to group your values and try to narrow them down to 5 core values. Remember before when we had marriage and children, those could be grouped together as relationships. So I want you to bring those together and narrow them down to 5 core values. Now, you may have naturally put them in an order as to what is most important to you. If you didn't do that, go ahead and proceed to step 3. In step 3, I want you to order your core values from most important to least important. We fully recognize that they're all important, but what is the top value for you? Because if you remember, if we're not aligned with our values, change is way harder. If it's impacting your value, you're more likely to change. So we have to first recognize what are our values. So try to come up with the top 5 and order them in important from most important to least important. Lastly, I want you to keep a thought log. From now until you watch the next video, I want you to really pay attention to the thoughts that you experience. When you recognize yourself having an automatic negative thought, I want you to write that thought down. I want you to pay attention to what triggered that thought, and then I want you to record the emotions and the behaviors that are attached to that thought. Later on, this information will be really important when working with your therapist. That's all for session 2.